forward to everybody's favorite get-along topic, the Affordable Care Act, and questions coming from Kevin Landrian.
Governor, under Obamacare, employer health plan premiums have gone up $5,000. And the Obama administration announced last week individual premiums on the exchange would go up 25% nationally, though the rates are lower in New Hampshire, some plans as high as 15%. How can you tell mom and pop businesses that the ACA is a good deal for them?
Well, first of all, as many of your viewers know, my husband Tom and I have 2 children, the oldest of whom happens to have very severe and pervasive physical disabilities and a lot of medical conditions that go with that. At various times, Ben has had as many as 9 or 10 doctors and over a dozen medications. So we are well aware of the strengths and flaws of our healthcare system. The Affordable Care Act certainly needs some very important improvements, but we can't go back to a time before the ACA where people with pre-existing conditions couldn't get coverage. We can't go back to a time where students couldn't stay or young people couldn't stay on their parents' health insurance. Now, we know for small businesses there are some real challenges with the ACA, but one of the things that the ACA allowed us to do in New Hampshire was put together our bipartisan Medicaid expansion program, which is providing health care to over 50,000 hardworking Granite Staters. If you repeal the ACA, you pull the rug out of those folks, and my opponent has voted to repeal Medicaid expansion now 5 times. And we know we have to continue to improve the ACA, but we shouldn't completely repeal it.
Kevin?
You know, Senator, this is another issue that voters are really skeptical that anything's going to change. The House Republican Congress has 40 times passed the repeal of Obamacare. All have fallen flat. So tonight, what can you say can honestly be accomplished next year in Congress so that people continue to have health insurance, but that it's not outrageously expensive?
Yeah, this is such an important issue because I'm hearing from so many people in New Hampshire higher deductibles, higher copays, higher premiums, and the Affordable Care Act, unfortunately, is not so affordable for New Hampshire families and especially small businesses. Having roundtables with small business owners, my husband has a small business, but others who are hearing very significant increases that they are getting, especially for those small business owners. And, you know, I know one thing, if you elect Governor Hassan to the Senate, you're going to be in a position where we won't make changes to address more competition, more choice, more transparency, and really making sure we drive down healthcare costs. She talks about my votes. I did vote 5 times to see if we could repeal and replace the Affordable Care Act. But I've also voted, when it came to a vote on Medicaid expansion, to expand that for 2 years so that we could have more flexibility for states in serving those populations. I don't want to go backwards on pre-existing conditions. But if we don't make significant changes to this law and have, instead of one size fits all from Washington, which, by the way, Hillary Clinton wants to expand it, not address the rising costs that so many are struggling for in New Hampshire.
Thank you. Take 30 seconds. And also, you said that it needs some improvement. Give us an example.
Sure. So first of all, our Medicaid expansion program, bipartisan in New Hampshire, is a state-specific solution that Senator Ayotte has voted to repeal. So when you think about what the improvements are, we need to, among other things, lower the cost of prescription drugs. One of the things that Senator Ayotte has failed to do in the Senate is stand up and allow Medicare to negotiate for prescription drug prices, something I support. She's voted against allowing us to import prescription drugs from Canada, which would add competition. She has stood with Big Pharma as they have been a major donor to her campaigns. Governor. And that's really one of the differences between the two of us, but it's one of the major things we could do to lower health care costs. We also need to repeal the medical device tax and the Cadillac tax.
Thank you very much.